Hi there. For those of you that don't know me, my name is Amy Baker and I'm the trauma educator here at Loudoun. I've created a short PowerPoint presentation to help with ordering blood for our trauma patients. This has been a collaboration with Blood Bank and Trauma to ensure a smooth and concise procedure. All right, so we have three options to get blood fast. We have O-negative emergency release, we have whole blood emergency release, and we have MTP, our massive transfusion protocol. All right, let's talk a little bit about whole blood eligibility. All right, males 11 and older can receive whole blood. Females 50 and older can receive whole blood. Okay, so let's go over the process. Trauma patient comes in, do they need blood? They do. Do they meet criteria for whole blood? We just went over the criteria, males 11 and up and females 50 and up. Okay, you're going to order emergency release. We will get 2 units of emergency release blood, and the trauma scribe will order either whole blood or O-negative in Epic. You're going to call the blood bank at 6095, and they will ask you the patient's sex, the patient's age, the alias MRN. The nurses will fill out the blood component form. We'll go over in the next slide. Reminder, you do need a signature from the provider on the paperwork that comes with the products on any uncross-matched product we give. We do want to transition to cross-match blood ASAP, so we should be sending samples with blood collection. After the emergency release, is the patient still bleeding? Do we need more blood? If the answer is yes, we're going to transition to MTP. The trauma scribe will order an Epic and call the blood bank to let them know. They will fill out, again, a blood component request form. Then the first cooler will be either 4 units of whole blood if they meet the criteria, or it'll be 4, 4, and 1. So 4 of packed red cells, 4 of plasma, and 1 of platelets. It can be cross-matched. If not, it will be O-negative. So on here, I did put 6 units of whole blood as the maximum that you can get. So the second cooler on will always be 4, 4, and 1. So these are the forms. These are the blood component forms. Okay, let's take a look at them. So Blood Bank has requested that you either check emergency release or MTP, or massive transfusion protocol, only. So if you have an emergency release, just click that box, and when you send the paperwork down, please do not mark emergency release and then either whole blood or red blood cells. Okay, they only want 1 box checked on here. So it's either emergency release or MTP. All right, so this is just a quick review. So the patient is hemorrhaging. We're going to order the appropriate emergency release option in Epic, either whole blood or O-negative. If the patient is still hemorrhaging, we're going to order the MTP. And then you're all done. Just a reminder, have the provider sign the downtime transfusion records for any uncross-matched products. We're going to send the yellow to the blood bank, and we're going to scan the white copy into the chart. So this is a copy of the form that you're going to receive when you get the blood. Sometimes they have a different form, but you are specifically looking for the physician's signature piece. The physician must sign the form before you return it to blood bank. Please fill out the information listed on the form. You can either put the vital signs here on the paper, or you can actually put it into Epic. If you look right above, it says blood product administration. It has a little box with CEMR. So you can either put it here or in Epic. You don't need to do both. Once the transfusion is finished, completed, please make sure the signed form is sent to the blood bank. Please make a copy and scan it into the chart as well. Okay. I wanted to show you an example of what the order will look like if you are the trauma scribe or if you are the one ordering blood. If you type in emergency release, and don't forget to switch to the facility list from the preference list right on the right-hand side, you can either choose here RBC emergency uncross-matched or whole blood emergency release. Either of those, that would be the order that you're going to put in for the emergency release. So let's talk quickly about the MTP order set. Okay. First thing to note is the MTP order set defaults to whole blood. Please uncheck if you want O negative blood. Okay, like we went over before, the first cooler will be either 4 units of whole blood or the 4 and 1, 4 packed red cells, 4 plasma, 1 platelet. Okay. It can be cross-matched and is preferred if the samples were sent quickly to the lab or to the blood bank. The second cooler through infinity, so second cooler on, will be 4 and 1. Just keep in mind that they will not hold a cooler for a component that is not ready. They will go ahead and send it without the component. And then they will send the component when it is available. Okay. Automatic lab orders for routine electrolytes after all the even numbered coolers. Don't forget to watch for those and draw those as needed. And again, the providers need to sign the transfusion documentation form that's attached to each uncross-matched blood product. So keep an eye out for that, and don't forget to make a copy to put in the chart and send the copy with the signature to blood bank. So this is what the order set looks like for MTP. If you put in MTP in the search bar and you switch again from preference list to facility list, you will see right here, the adult massive transfusion order set. And you click on that and you can order the MTP here. This is a copy of what it looks like. As you can see, the whole blood right here is automatically checked. If you do not want whole blood, please make sure you uncheck that so they will not send you the whole blood. Okay? This is just a quick glance flow sheet that kind of will help you flow through the process. Everything we already went through gives you a reminder for what whole blood can be, who whole blood can be used for, kind of gives you an idea. You're putting the emergency release, you're calling blood bank, you're checking emergency release only in the form. You're going to receive 2 units, either whole blood or O negative. There's still hemorrhaging. You're going to order the MTP, call blood bank again, check only MTP on the form. And there's a reminder here that the order defaults to whole blood. Uncheck if you want O negative. And then the blood bank will continue to get the coolers ready until told to stop. And it also talks to you about the triplicate form. The physician must sign, and then you need to return forms to the blood bank, and you need to scan one into the chart. Also here on the left box here, it says, if you see a transfuse order, ignore it. So some people have seen a transfuse order pop up on the uncrossed matched emergency release or MTP orders. Please ignore the transfusion order. You cannot scan uncrossed matched blood. It comes up when blood bank puts things in on their end. It will drop off the chart when the patient goes to the floor. If you have any other questions, please reach out to me. My extension is 8671, and we can talk about it a little further. Thanks so much for your attention.